So, what if you had to wait an entire decade to get the right diagnosis for a medical condition? It sounds kind of crazy, right? Well, today we're going to dig into a huge medical puzzle that affects millions of people, a mood disorder that so often flies under the radar, and what we can do to change that. 10 years. Let that sink in for a second. That's not just some random number. It's the shocking average amount of time it can take for someone to get an accurate diagnosis for bipolar disorder. I mean, that's a full decade of confusion, maybe getting the wrong treatments, and just struggling when you don't have to be. So the big question is, why? Why does it take 10 long years to get it right? I mean, with all of our modern medicine, that seems almost unbelievable. But the answer is actually, well, it's kind of hidden in the very nature of the condition itself. At its heart, this whole diagnostic mystery is really a tale of two moods. You see, bipolar disorder isn't just one constant feeling. It's a cycle. And the key to this whole puzzle is that doctors, they often only hear one side of the story. Okay, so on one side, you have depression. And these are the symptoms we all recognize as a problem, right? Feeling hopeless, totally exhausted, you can't focus on anything. This is what makes someone say, okay, I need help. But then there's this other side, hypomania. We're talking high energy, feeling amazing, being unbelievably productive. Now you got to ask yourself, who's going to report that as a medical problem?
And this is just so important to understand. From the patient's perspective, especially after coming out of a really crushing depression, that hypomanic episode, it doesn't feel like being sick at all. It feels like a breakthrough. It feels like, yes, I'm finally back to my old self, or maybe even better than your old self. So of course, that's not something you're going to think to mention in a doctor's office.
And here's where this whole thing gets really serious. This isn't just about getting the label wrong. A misdiagnosis is more than just frustrating. It can be actively harmful. The wrong treatment doesn't just not work. It can actually make things a whole lot worse. So think about it. When a doctor only hears about feeling sad and having low energy, the logical conclusion is major depressive disorder, or just depression. But the treatment for that is completely different from the treatment for bipolar disorder. So here's the dangerous domino effect that can happen. A person goes in, reports feeling down, and they get prescribed a standard antidepressant, usually an SSRI. Now, for someone with undiagnosed bipolar disorder, giving them that kind of medication can be like throwing gasoline on a fire. It can completely destabilize their mood cycles and even trigger a manic episode.
Okay, but here is the good news. There's a way to cut through all this confusion, to shrink that 10-year wait. There's a really simple but powerful tool that can unlock a much faster path to clarity and getting the right kind of help. And the solution isn't some complex, super expensive medical test. It's actually a pretty straightforward screening tool that just asks the right questions, the questions that help uncover that often missed high-energy side of the mood cycle.
And here's the absolute best part. It takes just 2 minutes. That's it, 2 minutes. You think about that, 2 minutes to potentially head off 10 years of misdiagnosis and struggle. The fact that this is so accessible is a total game changer. So this tool is called the Mood Disorder Questionnaire, or just MDQ for short. It's basically a simple list of questions you can answer yourself, and it's specifically designed to look for those periods of high mood and high energy, the hypomania, that just get missed all the time. For anyone who's dealt with depression that keeps coming back, this is such a critical first step. And you can take it right now. The team over at Coping and Healing Counseling has actually put the MDQ screener on their website, totally free. You take it, you get your results right away. This is such an empowering first step you can take for yourself. Now, this is really, really important. A screener is not a diagnosis. So the key is what happens next. Think of the MDQ as a bridge. It's a tool that gives you incredibly valuable information that you can then take to a mental health professional for a full evaluation, and then you can build a real plan for support.
For instance, places like Coping and Healing Counseling, or CHC, they offer exactly this kind of professional support. They're a telehealth therapy practice that serves the whole state of Georgia, and their team of licensed therapists really specializes in mood disorders. And they're really focused on making care easy to get. They work with a ton of different insurance plans, including Medicaid. And because it's all done through telehealth, you can get help from literally anywhere, which gets rid of huge barriers like travel time or taking off work.
So if this sounds like something that you or maybe someone you know could benefit from, here is all their contact info. Taking that next step from the screener to a real conversation with a professional, that's where the change really starts to happen. And that kind of leaves us with this one big thought to wrap things up. That gap between suffering and getting the right help can feel enormous.
But sometimes all it takes to start closing that gap is the right information and a simple first step. So could 2 minutes of your time really shorten a 10-year wait?